Dear members of White Army, in the continued series of these career counseling sessions, we have a particular session about pediatrics today. Yes, when we hear the word or the branch pediatrics, first things comes to our mind is PGI. Yes, the best place to be in for pediatric residency is PGI Chandigarh, the most premier institute of our country. Okay, so to know more about this, why PGI is best, or how is residency out there, what are the pros and cons, what the training module is like, to know all these things, the experience, the one's own experience will be shared by my very good friend of mine, Dr. Prabhu Hiremath. He did his MBBS from Shivamogga Institute of Medical Sciences and went on to do MD Pediatrics from PGI Chandigarh, and currently he's pursuing DM Neurology in MSRMC Medical College, Bengaluru. Very good leader and very good senior and guide, and I thought he's the apt person to guide and motivate our White Army members to take up pediatrics in the best possible institute. Thank you and welcome to Dr. Prabhu. We really feel privileged to have you with us today.
Hi everyone, and I'm equally feeling happy and privileged to be here on the platform of White Army. Always nice to see Kishan and meet up with him virtually or in person. So thanks me having here. I will give whatever I feel best possible ideas or suggestions, advices regarding doing pediatric residency as PGI. So looking forward to the session.
Yes. Thank you, Prabhu. So yes, like I said, it's a dictum. Pediatrics means PGI. PGI means pediatric. You agree with me?
Hello.
Prabhu, can you hear me?
Yeah. See, I can have biased opinion. Yes, I do agree. But having said that, there are excellent centers other than PGI too, which provide a good pediatric residency. Okay. But if I have to choose one in the country, then that, of course, that is PGI Chandigarh, Advanced Pediatric Center we call. So yes, the kind of residency program PGI runs for pediatric residency.
Prabhu, you are muted. 1 second, you are muted. Okay. Yes.
The kind of residency program PGI runs for its pediatric residents is excellent and unique. And I would say it's a world-class residency program we have in India. And being done my MD Pediatrics from there, I can vouch for that it is the best residency program we have currently in India. And some would even go to the extent say it is the best pediatric residency program in Southeast Asia. I'm not sure about that, but I can vouch for that it is the best in country.
Why? What makes it so special? Maybe the learning environment, or the teachers, or the patient load, or what makes the institute so good for residency?
I'll just give the glimpse of it. See, in any other institutes, we run pediatrics like we have unit systems. Unit 1, Unit 2, Unit 3. Weekly, you have 2 OPDs or 3 OPDs. Weekly, you have 2 admission days. Weekly, you have 2 days of rounds. That kind of culture we do follow everywhere in India. It's happening. But what's so special about PGI is the kind of program they're running. They, even at MD Pediatrics 36 months, 36 months will be divided like you will do the PICU residency 6 months. You will do emergency residency 6 months. You will do the 3 months of neonatal in ICU and 3 months of labor room and general ward of neonate. So, and you will be and rest of the period will be divided like pediatric neurology, pediatric endocrinology, pediatric rheumatology, pulmonology, genetics, nephrology. So you name any other subspecialty, you name anything which is in adult. That is there in pediatrics, which is quite unique. It is not there anywhere in India. You can name any subspecialty. See, that is the kind of training we are going to get. We don't have any general pediatrics. It's good to have general pediatrics. but we don't have any kind of that kind of approach there. You will be thorough with emergency management, and you will be thoroughly exposed to all the super specialties. It's like a month-wise roster you have. So it's not like in a week you do sit in OPD for 2 days, you will do only rounds for 2 days. It's not like that kind of culture. It's a culture like you will be each month you will be doing a different activity. Either you will be in emergency or in ICU or in wards. So that is what makes PGI special. For me, example, uh, my life was divided like in when I was doing MD. It was like I did 6 months of emergency, which you should get over within 2 years, and 6 months of PICU, and I did 4 months of neonatal ICU, followed by 2 months of neonatal ICU in emergency. So the kind of emergency exposure you have in PGI, it is damn good. It is as good as anything it can get. So this is, I mean, from point of reach, from the first point, you are the first contact when child comes. From that point till the baby goes home, you can follow up the child. I mean, the kind of procedures you do, the kind of way you manage in PICU to any extent, you will all textbook management, what we have been described.
Protocol based.
Yeah, thoroughly protocol based management. There are no room for error. You are being monitored, you are being scrutinized, and that kind of management you get. There is no room for error. There is no room for what should I say, any compromise.
Okay.
So it can get little stressed, but it is the best practice, or what should I say, management you are going to learn. Confidence. Yes.
So now the earlier we had separate exam, Prabhu, but now that it's under INACET, so
Okay.
the common entrance exam. So what should be the rank, is safe rank to get a PG seat of pediatrics in PGI?
Okay, when I wrote my PGI exam, it was separate exam, and my rank was 14. So since the exam is diluted now, and considering there is a reservation system, I think I will just stick it to general merit, I will say. So it can extend to any. I think less than 100 should be needed. If you are 100. Say, to be safer category, you less than 100 you should have in INACET. I think you can extend, if you're lucky, it can go up to 150, I can feel.
How many seats are there per session?
Per session, it depends on the output. The output batch is quite big, and you will have large chunk of seats. I mean, it will be divided some foreign national seats and sponsored seats. So nobody can have idea before they will release the seat
on an average 10, 15.
Average. For general merit, average I think 4 to 5 seats. And OBC 5 seats, and the category, I mean, average 15 to 20 seats every 6-month session.
So what should be my, like, yes, I have decided now I want to take up pediatrics, and fortunately I got into a good rank, and I have into PGI now. So what should be my strategy before starting the residency? Do I need to, because it's a big institute and very only complicated case comes there, so I need to be well prepared both physically and mentally. So what should be my preparedness strategy before or just while joining the institute or department?
See, being in that institute, first few days is quite overwhelming, and everything looks new, and everything you feel like you have never seen and never thought of, never heard of. Those many things will go on. So you need to be open-minded, I would say. I mean, it's just a matter of time till you adjust. The food, the culture, the practice, the institute, the way the institute works is quite different. It's very busy. I need to be very honest with you. It's very busy department, and you are expected to work sometimes more than 12 hours. Unless you are in some OPD posting, you are expected to work. And first 6 months or first 1 year is going to be physically and mentally may drain you. Okay. It's how you can, what is your threshold depends on it. Okay. So you go with open mind, and you keep open mind, and you try to enjoy what you are going to do. So keep an open mind. Please, it's not like you will be left alone. There are many people who are around who are going to help you any given time. You will never alone in PGI. Thing is, you need to have open mind. I mean, it's not like you what I want to convey is free work. You are there to learn. So just keep open mind. You will learn like anything. So I would say physically, yes, you need to walk a lot. You need to run a lot for the collection of reports or to the management issues and all those, so many patients. And mentally, you sometimes it's like sleep, you cannot get adequate sleep. So you need to be mentally prepared with that much. Other than that, there is no issue. Only the working hours can stretch little bit more, and keep an open mind, I would say. If you enjoy it, I don't think it should be a matter of concern for you.
And how do you manage like 3 years of residency, first, second year, and third year, about the learning, practical learning aspect, also about the theory study, and also what about the academic schedule, seminars and other things?
See, the day starts in PGI, except for the people who are on night shift. Their day starts at 8 p.m. at night. See, the day starts at PGI at 7:45.
Okay.
The 7:45, you are going to begin with the lecture class.
Mm-hmm.
So your day starts, you think that it's by 7:30. Mm-hmm. So you need to be there at lecture hall by 7:30, and 7:45 class will start. It's like one day you have journal club, one day you have case presentations, one day you have mortality meeting, one day you have teaching classes, one day you have, I mean, it's divided like that.
Understood.
Okay. So your day starts 7:30, and for all 3 years. It's not like only first year has to go at 7:30. It's not like, even the consultants who work there, they starts at 7:30. So it's a standard time. And academics, see, in PGI, it's more of practical learning. What I feel, it's more of practical learning. To be frank, I couldn't read much during my initial 1.5 years, because work was like, it was stretching beyond time what we were supposed to. And once we go home, we are like, okay, let's just sleep or have some fun kind of mentality. So practically, see, whatever you do, you're going to write that in exam only. You assure that you will do whatever being in given textbook. If you read once after doing everything, you will feel that great about it, because you must have done everything, whatever being in textbook. So it's more of practical learning in PGI. So
case wise you study. You have a case in the ward.
You get to see all variety of cases and every
all possible complications.
All possible complications, possible worst scenarios you will definitely. And it's more of academic sessions are excellent there, but you will more learn from practical. You will enjoy practical more than just reading textbook there.
So what about the thesis and all? Because it's a more of a research-oriented institute, so you must be given high importance for thesis or writing or publications, etc. So if I'm a student who is more into like research and other things, so am I given enough opportunities?
Yes, if you are more into research and all, there is I mean, you make sure. Take it for granted that you are in excellent place to do that. You are well supported. A lot of funding is there. Consultants themselves are totally research oriented people, and thesis is very strict there. You cannot bluff. That's one thing. Whatever it is, you need to follow the moral and ethics of the thesis while doing it. And consultants are very particularly, they are not toxic about it, but they are very strict about it, how you do it. So you cannot bluff. You need to stick to the ground rules and do it. And thesis is considered as a serious business there. It's so you should take it as a matter of
you can't keep it for the last moment.
And at it, you will reap the benefit also. You may get to present some word platform I did, okay, and you may receive well funds, and that is all there. But thesis is a serious business in PGI, and you need to go with the mind that you will do good. Whatever topic you are going to get, you be open-minded and do good research. If you enjoy that, you will have a lot of opportunities. It's not just not thesis. If you are interested in any other research-related work, you can just consult any consultant. I mean, they will help you out. So research is little stressful, but think that it is a good opportunity for you to learn how to do a research. They will teach you. Consultants will literally teach you how to conduct a research study, which might help you in your future, which is a excellent learning. Consider it as a learning and take it seriously. I would advise.
I've seen my friends doing minimum 8 to 10 national or international publications when they're just out of the PGA. It's just a simple like norm for them. Many
crazy people are there. Some crazy people are there. They do that.
Minimum 8 to 10 publications or research articles in their names. Just while doing residency itself, it's a big good platform to launch themselves. They come out. Excellent. So you were telling repeatedly about stress. Okay, how much you are good you are academically, skillfully, everything. Yeah, initially, as you said, they getting into the new environment, new work culture. It's a bit tedious and takes time. But even then, pediatrics is such a branch where you need a lot of attention and care. Okay, you can't deviate yourself here and there, especially when I'm in NICU and PSU. You need to give 200% to save those sick children. Everywhere you can see that crying sound only. So you need to be extra alert and you should be giving your best. So naturally it becomes stressful. So how do you deal with this, Dr. Prabhu?
See, if you take pediatrics, it is not just PGI is stressful. Anywhere pediatrics is a little stressful job because the common goals, it's the toxicity is not because they want you to get hurt and all.
Correct.
That all common goals is towards getting the child better. So we should understand that. So wherever there is a department of pediatrics, there's always some stress runs through everyone's blood. Because provided our subject is very volatile, pediatrics
the
is
margin of error is very minimum. Even 2 drops of extra IV fluids also can kill a baby there.
So it's I use word stress because it's actually a wrong misnomer. I should use it should be very extra cautious. The proper word is extra cautious, but we use stress because it's easier to use. In pediatrics, more than any other department, you need to be extra cautious. And extra cautiousness is what itself is a little bit root cause for stress. Provided we deal with such sick children and lot of children, so everyone will be on the tip of the toes and running around and making sure that baby is doing well. And since there is no room for errors, everyone has to scrutinize what is going on. So that time you may feel overwhelmed and feel the culture is little it's stressful, I can't handle. So you should not come with that mentality. So ultimate everyone goal is to get the child better. So the common goal is one. So you need to adjust yourself and find what errors you are making and be good with your seniors and nursing staff and all, so that can be whatever I say stress can be channeled into as an opportunity for learning. So having said that, wherever you take pediatrics, there will be some flow of stress will happen for sure. The right word for the stress is extra cautiousness you need to have. Otherwise, it's nothing like that. See, since I was doing MD there, I was told that the situation there is much better. Since I have come out, I just, since I had to have this session, I called one of my friend who is still there in PGI. I asked, how is the stress level there? And she said, no, it's much better than what we had. So it's good. It's good. The culture is changing. The manpower is changing nowadays. So initially there were, so as the facilities are increasing, the stress level will come down. I take for granted that there is now much better. You can, if you are getting PGI Pediatrics, you can definitely.
No second thought.
Yes, it's good. Excellent.
I have seen you in PGI and also like after that also you have enjoyed 3 years of your residency at there. Okay, be it academics, be it with the patients, you have been always enjoying, and your after hospital hours also you have enjoyed. So what's your secret to make the best utilization of days? What's in every aspect?
Yes.
I should do the best. See, I always tell my friends, there are some like my friends like you are a perfect pediatrician from PGI. That's the tagline you get if you do a residency there in PGI. So you will be a perfect pediatrician from PGI. You can put a board anywhere. So how to make the best utilization of the facilities, the teaching, and the excellent patient load variety of cases, how to make use of these?
See, the only thing I can explain is your love for children.
Mhm.
So that will take care of all the things. If you love your children who come to your hospital, that's enough. That's more than enough. If you just love them, you will work better for them. The more you work better for them, you will enjoy them. They will get cured. They will go home. They will come and they will call you. They will meet you. They will
Correct.
wait for specifically for you for 1 hour. While coming, they will get some sweets for you and they will get some fruits for you.
Correct.
And I had some crazy children who used to you bought clothes also for me. I still I still kept it, not using. I mean, that kind of love you get.
Okay. They're pure and selfless people. Only selfless and pure people
Yes.
are the kids.
See,
The innocent kids.
ultimately, it's everyone is human, right? And what matters at the end of the day is life, how we go about it. So whichever area we are living in, whichever institute, whichever unit, that is, I mean, not that great importance. Ultimately, the life is important. So if you
Correct.
respect that fact, if you respect the feelings of the parents and the child who is going through the agony, and be good to be nice and be kind to that child, and everything will be enjoyed. I have been actually mocked by my friends that man, how can you be so chill and in that in that department everyone is so like always serious and all. You are so funny and I mean, what is the reason? It's not like that. I didn't have my fair share of some
Correct.
stress and all. I went every through it, but ultimately, what mattered is, I mean, the affection you get from your patient. That was ultimately matters.
So good. Even when I was doing pediatric cardiac surgery in Sri Chitra, okay,
Yes.
lot of sick people, all like post-op cases in sepsis or in low output syndrome, so many things. So always we have never had seen the sunlight also, because morning 6 a.m. to night, entire whole night will be in the ICU only. We all suffered from vitamin D deficiency. So, but even at the end of the day, what used to keep us motivated was the pre-op children. We used to, for 10 minutes, we used to go for the pre-op ward and enjoy with the kids, had some fun time. So this is what, see, when you have that urge to help the kids, when you see that blue baby becoming pink soon after one intervention, you will get a lot of, it's like second life. The baby who is will die in the next few seconds or a few hours and suddenly get a real life. Okay. So it's like such an incredible and satisfying moment for you that will keep you motivated to do more and better. No amount of workload, stress, or will come into picture then. So very rightly and very aptly said, Dr. Prabhu. And yes, the good culture is you have last after exam, you have some 6 months of senior residency. You have exam at 2.5 years, right? Not at 3 years.
No, it is for DM people, it is a 2.5 years, and for MD people, it is
in
a 3
surgery
years.
also they had a 2.5. No. 3
Sure. I mean, it's a 3 years for everyone.
Okay,
yes.
Fine. So what after residency? So after finishing such a good environment, when you come out, you feel like, no, this is not enough for me. Such kind of feeling you may get, okay, that work environment, maybe the protocols not followed properly, all those things. So what are the future, what are the possibility after residency? You can do, nowadays, a lot of super specialty options are there. Okay, and even you are doing neurology now. So similarly, a lot of other options. You can directly practice, or any fellowships you can do, or you can go abroad for further higher studies. So a lot of opportunities and options. So how to go about?
Doing MD Pediatrics in PGI itself opens up many channels for you. I mean, it's a kind of exposure which you are nowhere you are going to get. So by the time you finish your MD, you must have seen many international faculty, many people doing all the kind of excellent research in the field. They will come to PGI, visit that. So you will have excellent exposure to decide about what you are going to become. There are many people who channel their all energy into just towards research. Many people who come into private practice. Many people pursue the higher studies. The thing is, since PGI itself has many super specialties after MD Pediatrics, like pediatric endocrinology, like pediatric rheumatology, like pediatric nephrology, which I mean itself has many options. So it's not difficult to get into one of that program and get yourself uh, excelled in that particular area. It's up to your wish, what you want to do. See, for private practice, excellent. After 3 years of MD residency, you would have seen n number of emergency cases, handled n number of emergency cases. Good to go. After MD pediatrics, you don't have to do anything else. You just after 3 years, you can start private practice. Correct. But having said that, once you come from there, I mean, you feel quite disappointed because all you do hi-fi stuff there, and once you come, all you have to do is
that's what I meant. Yeah,
cough,
you will not feel satisfied outside.
You will not get satisfied. So you need to have some good mentality. So it will things take time. Even PGI was built in 1963 somewhere at that time. To come to this stature, everyone went through the great difficulty there. So things will take time. Either you have excellent opportunity to pursue the super specialty, or there are many fellowships around the country. After MD pediatrics, you can get into anyone, especially neurology. Fellowships are everywhere, in every corner of the country. And or you can use yourself for next 2-3 years in the field of research. There are many research fellows post will be there. Like they offer you good research post for the research. You can do that. And or you can go abroad because your CV will be better. You will be promoted or what should I say, referred from any good consultant. You can get into foreign programs. It's up to you. But the options are wide. It's just like what you want to do. You can either go for field of towards research. You can become super specialist. Easier for you because you can since train 3 years there. To get into there is easier for you. Or you can practice privately. The options are wide. Having said that, many people, what I see is the people who come out of PGI are they're more like idealistic kind of mentality. They follow idealistic kind of mentality. They are like kind of rigid that it has to be managed this way. So we only come with that mentality. Initial years will be difficult. I mean, you can't go with just easy going kind of thing is not a. So you will have to adjust for that, or you can build your own system like the way you want it. You can build your own system. So the thing is ultimately, see, I personally got bored when I came back from PGI. All I did seeing was cough, cold, vaccination, nutritional, and all, which is what not I had given much thought into those subjects when I was doing MD. So actually, I was bored and quite disappointed. But I have seen my seniors and my fellow friends who went through that phase are doing very well now. It's not like it's okay. Doing there is special, but ultimately you have to come back to ground reality. But thing is, you will have all the knowledge, wisdom, experience, and advice with you to change the system where you are part of it. So I can suggest that much.
Prabhu, the earlier, the only reason to take pediatrics over medicine was it's an end branch. Okay.
Yes.
Many prefer pediatrics, like or ortho for that matter, or surgery, with the feeling that it's end branch over. My studies will be over, and I can straight away become a consultant and practice well and earn like anything. But it no more holds good. Everyone like going for super specialty like pediatric nephrology.
I was the person who thought after pediatrics, okay, like this settled. Myself is
real starts, real life starts. Okay.
I mean, still MD pediatrics holds good. It's not like there is no future for it, but I suggest you please get specialized into something, because for research purpose, even nowadays the
better care for that matter.
Better care, better pay, better job opportunity.
Patient will be get benefited.
Yes, for better job opportunities and better income. See, ultimately, what is the end of the day? What matters is how well we are doing in our life. So that also very important. So it's up to you to decide either just MD pediatrics, if your own hospital or run to something, you are like business backup and all, that would be enough. Or you are more into subject and all, you need to specialize. The people I meet who are doing pediatrics, I tell them that just don't stop, man. It is not the end. You please decide the one particular area and try to pursue that matter till the end and get super specialized. That's what I'm telling.
And unlike MBBS, MD or DM or MCH for that matter, It's not a like a classroom teaching. You will be
Yes.
always with the patient, seeing the like a consultant only, but under the supervision of someone. It's good only. So you'll be working like a doctor around the clock, seeing the patients in OPD, OT, ICU, everything, and you will be paid also for that. Whatever you're doing, you'll be paid. Like in institutes like PGI, even a resident, junior residents is paid much more than a consultant surgeon like me. Okay, one and a half lakh.
One
So
more
handsome like salary like that. So there's no reason to come out of any thing like courses like that. So
see, one
DMS
more
or MCH is not a big deal, I feel. Okay, it's just that you are in an institute under the supervision of some seniors, and you are continuing to do whatever you wanted to, like surgery. Just do keep you yourself doing all the surgeries under some seniors supervision. So it's good to do that and learn more and better about one particular aspect. Prabhu, agree with me?
yes. See, one more thing I want to tell the people. The reason for my happiness was one more reason was the city itself, the Chandigarh. I was one of the residents who thoroughly enjoyed living in that city. It's very beautiful, very, what should I say, always mind calming effect it has. Whatever stress, if you have anything, if you just go around the city, just walk around the city, you will feel excellent about it.
Correct.
And for thing is, you will get good money to, I mean, spend and do other activities like you can go offer a trips, you can, you are not totally
A
independent.
lot of places are around also, around Chandigarh.
Yeah, is an
Different
excellent.
trips.
Chandigarh is excellent place to see. My favorite spot was Rishikesh, which I've been 3 times during my MD residency. It's not like, see, PGI means it's not like you are not going to do anything other than
Correct.
you will get time, appropriate time to have fun also. So it's not like it is all about work. It's not like that. We did work and we enjoyed the city. We enjoyed the place also. So it's just how much the way I like PGI, like equally I like the city, Chandigarh. It's amazing place, city itself.
Yeah.
And
Similar to your Shivamogga or Davangere or your like Mysore. Okay, in a better way for that matter. Very like I have seen very well planned city and a lot of greenery all around. It's I think most cleanest city, no? Like with Mysore, it's the cleanest city. The Chandigarh also.
Yes. And Kishan was there for a few days with us when he had visited Chandigarh.
So finally, Dr. Prabhu, there are so many aspirants, like so many attending, like Dr. Hriday, etc. They're very much eager to come to PGI or do pediatrics. What's your piece of advice for all the budding aspirants who are willing to take up pediatrics and your words of wisdom for them?
I just say go ahead, and if you are getting PGI, that's excellent. Go ahead and go with open mind. You don't stick that I want to do this at the end of the 3 years. That is not the idea. You should go ahead. See, you should go with open mind while entering MD. Learn everything and decide in the midway. Once you finish 1 year or 2 years, you will get to know what you want. See, I started liking pediatric neurology. By the end of 1 year, I decided I would end up as a neurologist. So that's the kind of idea you will get once you enter into MD. Be open-minded, be ready to do little more work, and also keep yourself at composure and calm state. So, and don't freak out. You will come to see a lot of sick cases, lot of children, so much agony every day you will witness. Make your heart, what should I say, hard, but be calm and kind.
Don't take it personally. Okay, see, if you think that it happened because of me, if you keep on creeping like that, gone. Okay, it's all the part. But always be ready to like all the criticisms and comments. Okay, be ready to learn. So undo some things and relearn the things. Minimize the mistakes. If you are like that, open-minded, like Prabhu said, you will excel. Definitely, you will excel. But if you're very stubborn, like no, I'll walk the way I want. If you're like that in central institutes like that, where they see only high-end cases, it will be
flexible. Be flexible. Be kind towards your colleagues. Your life will be very easy, and you will get help everywhere, from every corner when you are in trouble. So that's what I want to say. So like what you are going through. And if you are getting into PGI Pediatrics, I would say it's an amazing opportunity to experience the whole different level of 3 years residency life.
Yes.
It will take you to the every corner of it. Has potential to take you to the every corner of the world, because PGI Pediatrics is well known throughout the world. You can tap any opportunity that will give you that much. What should I say? The backup. It's a good backup. You can proudly say you are from PGI. And that you will live with your life. See, that's one of my HOD, retired HOD used to say. Throughout your life, you will use the word PGI for as your CV. I
Yes.
mean, you will know. You will
That's
know
what they
no
see.
chance.
See,
You will be.
that's what the others will see. Oh, pediatrics in PGI? Yes. That's
You
what
will
they'll see.
take the opportunity, no stone unturned, to make sure that people know that you are from there. You will write everywhere. So when you are going to do that, when you live there 3 years, and you should give your full
Yes.
potential, you have to work there. That's
Yes.
the service you are going to do the institute, so that the institute will give its benefits for lifelong. So that's
Correct.
what she told me once. The PGI Pediatrics in PGI, I would wholeheartedly say, just if you are having it, you are liking pediatrics, just go for it. Be open-minded. I mean, enjoy. Try to enjoy. And if you have any problems, and you are most welcome to talk to me through Kishan and however channel you like. So always one phone call away. Okay.
Yes. Yes.
Yeah.
So excellent insights about a beautiful branch like pediatrics. Wherever you do, it's pediatrics, but doing it in PGI, it's gives a special edge over others.
Special.
Thing.
Yes. Yes.
Yeah. Okay, so that's all about. Yeah, one more thing, personal note, that is, many students are, especially from South India, they are a little apprehensive about the language and culture there, North Indian culture. No, I have personally have been to PGI and seen every other step, every second step you meet a South Indian, that from Karnataka, Andhra. Okay, lot of South Indians, even professors for that matter, they have studied there and they settled. The South Indians, so many students have become professors there now. So it has become like a mini
Any,
like Karnataka
see,
or
there is no such thing as South Indian people are quite issues there. See,
no.
you need to be open-minded. You need to learn the language. I would say sincerely put good
Hindi is a
effort
very
to learn
simple language.
Hindi. So it's not like the patients who need to be heard, So if you don't know their language, they will get frustrated. So for the sake of professional part of profession, you need to learn Hindi language.
Yes.
Rest everything will be taken care of. That is
And
one.
you are a very genius and you have high IQ to learn any new language within a few weeks or matter like 1 or 2 months. That's a language and a place should not be barrier at all. Though who is interested to learn or excel. Okay, all these
Yeah.
things are food. Some people are cribbing about food. No, it's you.
No, see,
Nowadays,
man,
you have all kinds of like hotels there. Like you want Bengali hotel, you want Karnataka hotel, Udupi hotel, or the Rajasthani thali. Everything is available in a
food is
doorstep.
not food is not an issue. There is a 7 sector
In
dhaba.
fact,
There
one
is
of the
one.
best cities to enjoy food is Chandigarh.
Yes, whatever you want, you will get a very good food. I mean, don't have to worry that North India means no. I used to enjoy a lot of good food there. I had my favorites hotels also. So it's food is not an issue. Don't worry. The culture is not an issue. The city is most welcoming and love you all. Just learn good
PGI
Hindi.
hostel is also good, and they encourage a lot of sports also. I have seen CTVS residents everywhere. They'll be very busy, but at PGI, after doing cases, they'll be playing tennis and
Yes,
basketball. CTVS residents, just imagine. Okay,
yes, yes.
it's a
Uh,
good place.
Hostels, some issue is there. Hostels is quite hold, but getting good salary makes you to able to afford the outside houses also. So it's not an issue. Food is not an issue. Stay is not an issue. People are very loving and welcoming in Chandigarh. There is very class city. You will have good fun. So just don't worry about all those things. I mean, just I would suggest before, if you don't know Hindi, learn basic Hindi and come to Chandigarh if possible. Otherwise, you will learn there only. I have seen all my many friends learn. They didn't know what is tum, aw. These letters also they didn't know. They learned quite good Hindi in 3 months of span. Not an issue. Don't think. Yeah.
As a moderator, my concluding remarks of the session is: for pediatrics, consider PGI. For any problems, consult Prabhu.
Can do that.